To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Today we're going to talk about a new procedure giving people relief from carpal tunnel syndrome. And I am joined by Dr. Amy Yeatman from Ovation Hand Institute. Hi, doctor.
Hello.
Well, let's just get into it. What is carpal tunnel? Because I think a lot of us just think my wrist hurts.
Sure, carpal tunnel is very common. Carpal tunnel is actually compression of the nerve that kind of runs in the wrist to your hand. And when you compress that nerve, people get numbness, tingling, pain. It wakes them up at night.
Yeah, and it's more than just a little ache. And we probably shouldn't just
It
hope,
is.
right? We should probably get that checked out.
Yes, a lot of people don't even realize that they have it, or they don't want to get it checked out because they don't want to have surgery, but it's a really good idea to come in and have it checked out.
And we talked about a procedure that Ovation does that's unique. So let's maybe go through the normal procedure and then how you give relief.
Sure. So traditionally, the normal procedure is going to be, in the operating room, an incision. It's going to be 6 to 8 weeks of recovery, bracing, physical therapy. We have something new, very innovative, minimally invasive, where there is no incision. It's a needle poke, probably like getting an IV, and another needle poke, like getting another IV. And all of the surgery is done through those two needle pokes under ultrasound guidance. So patients come in, they get back to work the next day or the day after that. Because there's no incision, there's basically very little recovery time.
And I would imagine there's a whole bunch of people out there that work with their hands and can't be laid off for a long period of time. So they may have put this out because they think their only option is major surgery.
Sure. If you are somebody who can't take the time off of work, you can't afford to be off work for 6 to 8 weeks, this is a procedure that gives you that relief and gets you back to work. If you have the procedure on Friday, you can go back to work on Monday. It's a great option.
Ovation completely embracing that technology, that procedure with your good doctors. Now, somebody told me they were in and out in an hour.
That is very true. From the time you check in to the time you leave for being done with the procedure and you're walking out the door, it is less than an hour. There's no sedation, so it's a quick procedure. So you are in and out and back to life.
And you don't need a doctor referral to be stuck in a system. You can go to an independent place like that to get this.
Sure. A lot of times people don't really know about this procedure, and so you could just look on our website, give us a call, come in for a consult, find out about the procedure, and go from there.
All right. Well, Dr. Amy Yeatman from Ovation Hand Institute, thank you so much for helping our wrists get better.
Yes.
And we want to thank you for watching To Your Health.
The preceding was a paid advertisement.